Okay, this is part two of the current video series I'm doing, the mini-series, When Too Late is Still Too Early. So part two will be a couple of review and reaction videos. Now, the doctor on this, the old doctor, the guy who will be standing on the left, was the doctor who did mine back in 1993. He looks a lot older now. When he was doing mine, I think he was in his late 30s or early 40s. He looks a lot older now, obviously, because he is older. But it's the same doctor, and he was the guy. He was one of the top doctors in Sydney, where I am, and I think he still is. But he's the guy who did mine back in 1993. He's got a channel called The Hair Loss Show on YouTube. You can look it up on YouTube, The Hair Loss Show. He goes into almost everything you can imagine about hair loss, hair transplanting, treatments, whatever you want to know. It's pretty much on there. It's a big history. So this is going to be one video, and then I'll do a video straight after this as well. It'll all be in this one video, and it's pretty much covering similar or the same topics about young men going bald and what to expect and how they need to manage things and whether it's right for them. So without any further ado, I'm going to roll this recording and we'll get into it. I'm going to let them speak for a while before interrupting them and giving my thoughts, so you get a better idea and you can listen to it a lot more clearly that way. Just put the volume up there and we shall go now.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome to the Hair Loss Show. My name is Dr. Vikram Jayaprakash.
I'm Dr. Russell Knudsen.
Welcome to episode number 30. So thanks again to everyone who's subscribing and liking our videos. If you've got any comments, please leave them in the comment section below. If you've got any questions, we're really enjoying those and hope you're enjoying the feedback that we're giving as well. So today's topic, we thought this is something that we get asked a lot in our on the comment section in our questions, and it is about treatment, and that covers the whole spectrum of treatment. When is a good time to actually start treatment?
Okay. I think the way I describe that, Vikram, is that, first of all, if we have a concerned relative, typically a mother, coming in with a young man wanting to know what's the right time to commence treatment, the first thing I'd say is that we as doctors have to be convinced there's something that's treatable.
New South Wales Great Walks. Which
You've
path
done
will you choose?
Have to be convinced there's something that's treatable. Okay, so if you come in and you're complaining about increased shedding, that doesn't necessarily mean we're going to treat it, because if that's a temporary increase in shedding, then it'll settle by itself.
Yeah.
So we would have to see evidence that we thought there was a progressive problem developing. And if we can find the evidence, then that is the right time to begin treatment.
So first of all, we've got to make sure that we've got the diagnosis correct.
Yes.
If you're losing hair, what is the cause of that hair loss? And that's why getting in and seeing someone and finding out if what is the cause of your hair loss. So for most of the time, what we're seeing is people with androgenic alopecia. So male, if you're male pattern hair loss. So the question is, I'm losing my hair. So when is a good time to start treatment?
Okay, so the answer is that because we like to use our video microscope, which is a 50-power magnification, and in previous episodes have demonstrated what the hairs look like when you magnify them 50 times, it's very easy for us to be able to decide if we think there is a problem developing with deterioration in the quality and the number of the hairs. We don't have to take photographs because photographs are notoriously unreliable because it's affected by lighting, camera position. Are you exactly in the same spot on the scalp? Which is why when we use scientific trials, we usually put a tattoo in the scalp so we can center the camera on the tattoo to make sure that we're doing counts or we're looking at exactly the same area.
And this is a valid point because I get asked lots, oh, look, if you're monitoring, do you take high resolution photography at various points? How do we know if the treatment is successful? My general comment about that is you're going to be the one who's going to tell me how successful the treatment is, because again, as Russell was saying, if you want to look at a particular area under a microscope and say, well, we've started treatment, well, is it the same? Is it slightly better, or is it deteriorated? You've got to make sure you're photographing the exact same area, and that's exceptionally difficult.
That's extremely difficult to do. So we look at these magnifications and we decide whether we're seeing something or we're not seeing something, because I like to joke with my patients that if they think they've got a problem, they have developed X-ray vision. And what I mean by that is, and I say this to the patients, is you guys don't look at the hair anymore, you're looking through the hair, you're looking for scalp. And if you start to focus on looking for scalp, you're always going to see it. And you could have essentially a normal head of hair, but now because you're looking at it a different way, you can't see the wood for the trees, to use an analogy, because you're just viewing it differently. So we first of all want to show the patient as much as ourselves what a normal healthy hair looks like, and then compare it to the area that they are worried about. And if there is a difference...
Okay, I'm going to stop there and give my thoughts. So Dr. Russell Knudsen, he's been around many years, as I said. He did my 3 hair transplants in Sydney back in 1993 in his plastic surgery / hair transplanting clinic. It's close around the inner city, just out of the city. And it wasn't, he said, mostly the mother who comes in. In my case, it was my father, because my mother didn't want to come in. She was like, she didn't want anything to do with it for some reason. She was like, yeah, just let your father go in. No, actually, I think, did Mum come in the first time? Mum might have come in the first time. I can't remember, but I remember my father being there. And yeah, it was mostly my father and me. My father took me to and from, he drove me to and from all the consultations and all the procedures I underwent, the 3 transplanting procedures. Yeah, they're going to get into age and how appropriate it is, and when it's probably good to see it, to start doing it. Yeah, they're talking about people who are just seeing little spots of white under the hair right now, and they're talking about people being over paranoid. In some cases they are, but in some cases it probably does represent you losing your hair. We'll continue going.
Then it's worth treating, because it doesn't matter what medical therapy or laser therapy or any therapy really that's short of surgery, it doesn't matter what you use. The current technologies teach us that we're better at preventing deterioration than we are at regrowing hair, particularly if it reaches a certain degree of thinning. So the bottom line...
Okay, that's a very important point he's made. Hair transplanting is not the end solution to most cases, okay? Basically, you should be on medications and a lot of, what you're deficient in. The reason you're losing your hair, you need the medication to start blocking that. If that doesn't help you, then you basically need to start doing hair transplants, but not before then. So for any young man who's going bald, I would say go to your dermatologist, your doctor first, before you go to any hair transplant surgeon. Get on the right pills, the right drugs to stabilize or regrow your hair, which I didn't have the luxury of doing back in my day. They weren't available. There was only these minoxidil drops that I used to put on my head that were really itchy and never stabilized or regrew hair for me. But there are a lot of other more powerful things now on the market. I would recommend you go and do those before you seek hair transplant therapy, because once it goes too far, it's too late. So you basically need to stop it, and that's probably the most effective way to do it, rather than hair transplanting.
That we would use, based on the evidence, the research we've seen, is that if we can get to a hair before it gets to 50% of its original size, we have a chance to turn it around and make it thicker. But no
So he's talking about hair miniaturization.
trial that's ever been done in hair loss products in the world has ever demonstrated that a hair, once it gets down to less than 50% of its original diameter, will ever come back and be a fully strong, healthy hair again.
That's right. And so, I mean, feel free to have a look at one of our previous videos. We did one on miniaturization. We looked at pictures demonstrating this. And this is a point that's been raised a couple of times in the comments. People talked about, I had very thin hair or no hair, and I started treatment and suddenly the hair grew back. That may happen, but it's not because there was no hair and all of a sudden the medication, caused you to grow perhaps making new hair in a particular area. What it meant was that there was a dormant hair follicle underneath, and that stimulated that to grow. So, but I think the point is clear, and we're clear on that, which is that if you're having miniaturization, you want to get in before that 50 micron mark, because
See, that's why the transplant surgeon I saw, the one this week, that's why he basically told me I needed to get it done when I was 16 or 17, not 19, because my hair, if you look in the photos in the last video when I was 15 and 17, there was miniaturization taking place as early as that in my life. So basically he was saying it needed to be treated while I was still in high school, and I think I've already gone through that. Wasn't going to happen. They're not going to take me out of high school for hair transplants. They're not going to give it to me while I'm in high school. So really, in effect, the bottom line is treat it as you see the hair miniaturization, less than 50%, you need to catch it because it's going to be too late beyond, in some cases, beyond that point to ever salvage.
You can start treatment before then. You've got a much better chance of pulling the needle back to better thickness or increased thickness.
Bingo.
Basically, the youngest patient I ever saw that showed.
Apparently it wasn't me. So I was 19 when I saw Dr. Knudsen. I'm not the youngest. Apparently I think he's seen younger since me. And I think he saw a few. When I went in, I remember him saying there have been a few guys have come in, not many, but a few guys around your age group that have come in to get hair transplants. I think it's younger than me, but I don't remember. We'll play what he says.
Signs of early miniaturization was a boy of 8.
Wow.
8 years of age.
Wow. 8 years old. He's not even gone through puberty, poor kid. Usually if you lose your hair prematurely, it's straight after you go through puberty. Now, I went through puberty early as a man. I was one of the first at school, one of the first guys at school in my year at class to go through puberty. I know women tend to go through it a bit earlier than men, but as far as a man, I was one of the first. And as soon as puberty, I used to have like really thick, curlyish kind of hair. But then after puberty, it turned wavy. And then about half a year to a year after it changed its patterning, my hair, is when I noticed the miniaturization. That was when I was 15.
This is like precocious puberty, if you like. What we mean by precocious puberty is starting early. He obviously was having some influence from the small amount of male hormones in his system at the age of 8.
Wow.
Now, if you've got someone in that exceptional circumstance, probably the only thing we're going to offer to an 8-year-old is something like minoxidil or laser. We're not going to give them finasteride. We're not going to play with their hormones because they're going through puberty. So the critical thing about that is, yes, we think finasteride has a better long-term effect than minoxidil and a better long-term effect than laser, but you have to be sexually mature before it's appropriate to offer that medication. So for most young men, if we're talking about men, for finasteride, we would say you have to be at least 16 to be on therapy, and even.
Yeah, I mean, if it was available when I was 16, I would have been on it straight away, without doubt. And that was, according to the doctor I saw yesterday for my the other day for my consultation. That is probably the time I should have been hair transplanting. So it should have been probably could have been on finasteride from a year or two before that even, at first sign. But we'll keep playing.
Today I saw a 16-year-old young man. He's almost 17, and he's been on finasteride now for 12 months because we felt that was appropriate.
Yeah, I was put on minoxidil. That's the most powerful stuff they had back in 1993. Before that, when I was in my teenage years, when I was in high school, years 11 and 12, I used to drop minoxidil drops in my hair almost, I think it was every day, twice a day. But yeah, as I said, it never really helped or never really regrew my hair.
He's responded very, very well. He's actually improved in the last 12 months at 16.
Good.
So it is not too early at 16 to do it, but we would be very reluctant to be using things like finasteride in someone who is still going through puberty and hadn't reached the end of
I remember
puberty.
you said 8 years. That's really. I mean, we spoke. I had a patient. I think it was 12, and I remember speaking to you about
Wow.
that as well. And we've in those scenarios, and thankfully
It's rare. It's rare.
Yeah, it is rare. I started going through puberty at about 12, 13 myself.
It's just pushing through to that period where they are hormonally mature enough that you can start on treatment to try and stop. So briefly going back over that, finasteride, what it's doing is it's blocking that 5-alpha reductase enzyme that's blocking the conversion of testosterone to dihydrotestosterone and lowering that at the level of the hair follicle, which will hopefully stop that miniaturization process.
And we will get to this in a future episode. We'll talk about microdosing and customizing dosing to individual patients and give you our rationale for it. And one of the reasons I want to do that as a specific video is because we're getting questions about microdosing and, about how long it lasts and does this add extra and doesn't. And we'll work through that because I think that the idea of customization is that not all patients are the same. And so because we're looking at a whole different variety of patients with different varieties of baldness and what I call the aggressiveness of baldness, then we have individual tailored plans that try to address that because the key is to keep the hair. So just to summarize again, what we just talked about, medical treatment begins when you notice a problem.
Yes.
Which type of medical treatment you use depends upon the age of the patient.
In a way, I could have hoped for two scenarios. We had medical breakthroughs a lot earlier than I experienced, and I was able to take that stuff when I was 15 and 16 instead of minoxidil, the more powerful finasteride. Or B, my aggressive hair loss at that age, which began at that age, basically held back for a few years until those treatments were available, those medical treatments were available. Unfortunately, I just got really, really shite luck when it came to that in terms of timing.
Now, if we go to surgery, because that's another important part of this, when can you start surgical treatment? We are generally reluctant to operate on very young men. And there are a number of reasons historically why that would be true. Number one, we had nothing that was preventing them losing their hair if they were very young. So it was kind of like quicksand. They're losing hair and you're topping them up, and they're losing hair and you're topping them up. And you never made them happy because even in my experience in my early years, some people were losing hair faster than I could replace it.
This is before for you.
Yeah, I saw you, Russell, in your early years when you were, you did me at 19. I think you told me something similar. You were worried about the fact that I was at that stage too far gone. Then you said that front third fill in and then the hair piece because you didn't think I'd have enough to fill the rest. Although you did offer me that option and you said you'd rather not do it. So I kind of went with what you said, Dr. Knudsen, and that's what happened. Yeah, I mean, I've lost the rest of it and I've got the grafting, a little bit of it still left. At the moment it looks awful.
Before you started them on finasteride, before finasteride became...
Before minoxidil.
Before minoxidil.
In the 1980s, I know that makes me old, but in the 1980s we didn't have minoxidil, and we certainly didn't get finasteride till the 90s.
Well, you did. I think I started taking it at the end of the 1980s. It was a new one. It was new. It was originally done for blood pressure. It was a blood pressure medication or tablet which they crushed, and they realised that men were stabilising hair loss and regrowing hair with it. I was on it. I'm pretty sure I was on it I graduated in 1991. It could have been 1990 when I started, because 1989 I was 15. 15 I was having hair miniaturization, but I don't think I saw the dermatologist about it until year 11, which was when I was 16, and that's when I went on the minoxidil. But you're right, They weren't. It wasn't available through the majority of the 80s. But what I will say is you were wrong with, and I think you come to it later in this video, or maybe the other video I did with the other doctor said it, that finasteride was available in the 1990s. Not in the early 90s when I had my transplants done. It was available later, a few years after that. And I think you even told me, I think Dr. Knudsen told me that there is something coming out called Premature, which would stop it. He said, but the way you're going, he said, you're going to need intervention right now. So, yeah, I mean, I was 19 and it wasn't fun. It wasn't good.
So back then, there was nothing you could do except operate.
Yep, that's exactly what you told me.
The younger the patient, usually the more panicked they are, which made them emotionally very, very labile.
I think you might be channeling those memories of when you were operating on me.
And they made poor decisions in panic mode.
Oh yeah,
and you didn't know what the outcome.
That is exactly what happened. My father and I were wet behind the ears. We didn't know. I didn't know. I wanted the freaking whole thing back. And I remember you told me something like, "Well, you're too young, and I don't know where it's going to go from here, so I'd be reluctant to do the whole thing." You did the front third and told me I need to do a hairpiece. I think you probably, I don't know how many you suggested. I did 3 with you. I think you said maybe 4 or 5 is what I needed, but when people started seeing the results, they weren't happy and told me to get rid of it. But anyway, I'll continue.
And the reality is there is what I've discussed in a previous podcast, what I call premature balding. The patient comes into me and says, I had it at the moment, but in 5 years or 10 years' time, I wouldn't care. Well, that's not a surgical candidate in my book if I can avoid it, because surgery is permanent and they have to deal with the consequences of the surgery permanently, whereas if you put them on medication for that 5 or 10 years, they can get them over the hump so they then become comfortable with it in their own skin. The worst moments in my life have been the 29...
Okay. I just wished, I'll just say this before he gets onto the 29-year-old bracket, but that's 10 years down from where I had it. But yeah, I just wish once again that these medical interventions, these finasteride, etc., were available when I was in my late teens. That would have been a game changer for me. They weren't, unfortunately.
Your old patient.
We're not you, but when it comes to protecting your money with SafeBlock, we can be your W.
Wow, your hair is so shiny.
Oh,
so
wow.
luminous. Who does your color?
Wow, I'd love hair like that,
Preference
woman.
by L'Oreal Paris. High shine.
Not that long, but
29-year-old patient. I think there's 2, I think there's 1, who came back to me. I'd operated on him at 19. He begged me, his mother.
that was me. Nah, just kidding. I never came back in with my mother, mate. I had it shaved off by then. If you operated on him when he was 19, like you did with me, because you operated on me when I was the same age, if I hadn't shaved it off by then, I dare say I would have been doing the same bloody thing, mate. I would have been banging down your door saying, just fix it, please.
I operated on him at 19. He came back at 29 and said, I wish I'd never done it.
I don't blame you, mate. I wish I'd never done it as well.
So now I don't care about it, and that for me as a doctor is devastating. I should not have given in to the emotionality of the situation, because now I've left him with lifelong consequences.
Oh yeah, you did. Oh, you've left me with lifelong. Mate, I'm still looking for a woman who will take me. Yeah. Oh yeah, that it's not a good look to have those thinning plants on the front and then the scars at the back. Yeah, lifelong consequences. You're not wrong about that, Dr. Knudsen. I'll agree with you on that. Yeah, it could have been me who went with his mother and knocked on your door, but you could have had more, mate, and I would have been the next one on that list.
And that's the key here, because hair loss is a very emotional thing. And if you're young and you're starting to lose hair, it makes, it's anxiety, it causes anxiety and all sorts of tension. So there is this push to say, right, you know what, I'm losing hair, I want to
fix yesterday.
I want to get on board, I want to do it. And one of the things that one of the things I'm actually very proud of is we're actually very, very conservative about both of us on who we operate on, and especially in younger people, we're really about pulling it back and going, let's rein it in, and we will.
Yeah, in my case, they couldn't rein it in because there were no medical treatments apart from the minoxidil for me that didn't work.
The big advantage we have now compared to the early era is that we have good treatment options for them, and that makes it a very, very important time to take that pause.
Yeah, back in my age, there wasn't that treatment option. There was only straight into the transplant, basically.
Because, any individual hair can only be moved once, which means there is a lifetime supply of donor hair that we can use in our patients. But I like the patients to be able to demonstrate to me over at least 12 months.
So did he just say there's a lifelong donor supply? There isn't. Once you lose it, you can't put it back in, mate. It's whatever's taken out, it's a finite resource.
At least 12 months that the medical treatment program is working, and that we've got control of the process, and that we aren't going to be chasing our tail on this one. So the advantage of it is it slows the process down. It allows everybody to assess what's going on, get a calmer view of it, and make a better decision rather than operating in panic mode.
So why do people regret it? I mean, that's the key.
Yeah. With me, it was panic mode. As a man, a young man, there's no, whatever was available at the time never worked for the hair loss. You're in panic mode because your friends are getting women, they're getting girlfriends, and you're not. And this happened to me. I used to go away with friends, and they all used to find girls who were interested in them, and me, I was the only guy alone. And it wasn't because I was saying or doing or behaving any differently to what those guys. We were all having a great time. They were just picked. I wasn't. It's natural selection.
And this is why we are quite conservative, is because let's just say someone's losing their hair and the hairline's moving back, and you go, right, I want to rebuild that frontal area. Well, first of all, we've got to take hair from the back.
Yeah, that's exactly what happened. They rebuild the frontal area only when you're young. They take hair from the back and put it in the front.
And then transplant it into the front.
Yeah.
This is a non-renewable source. So think of this as your savings account for hair. You're born with a certain amount of hair or money in your savings.
There's no interest payable.
No, and you can't make deposits. All right. So whatever withdrawal you make, that's got to last you a lifetime. So you've got to plan for, the next however many decades, is potentially there that you're going to lose hair. And let's just say one of the worst outcomes is that you're losing your hair, you transplant the front, and that looks great, but you continue to lose hair, and the hair...
No, it doesn't. I agree. I disagree. When you just transplant the front, like what was done to me by Dr. Knudsen when I was 19, what will happen is, you'll lose the rest of your hair. That happened. I was pretty much almost gone by then anyway. But, I mean, you'll lose the hair, and what will happen is, without a hair piece, it'll just look like 3 different pieces on your head. It'll just be a big bald spot in the middle of your head.
Hairline starts moving back behind that. That's going to leave these sort of horn-like structures in the front.
Oh, the gaps. That's what I've got now, the gaps. Oh, boy.
And it's going to look awkward, which is going to force you to have to come back and do another procedure to try and fill that up. Now...
Yeah, that's why I basically shave it now, and there's not much more I can do because, going back in, and then they told me the other day when I went back in that I don't have enough resources to do the full head. They can fill those gaps and they can go a little bit further back, but it won't be the density I want nor the coverage I want with the amount they can take out from the rest of my donor areas. So, be very careful getting into this as a young man.
How many times or how often can you come and chase that? Well, that's a topic.
That's a topic that can be explored in greater detail, but because it's going to depend upon the degree of balding. I mean, one way to think about it, people, is that the balder you are, the less resource you have to deal with it. Right? You've got.
Bingo, Dr. Knudsen, you are right. I commend you for saying that. I'm still not really happy with the overall results, but I'll commend you for saying that. The balder you are, the less resource you've got. And I found that out when I went for my consultation at the FUE clinic just earlier this week.
Less hair left on your head, the balder you are. So it becomes much more difficult when you've got extensive balding.
Yeah, because then you've also got, you've got less donor area from previous transplants. But not only that, I mean, you've got more bald area for coverage. You just need, with density and coverage, you just won't get it. with all that resource gone.
Is progressive. So what I say to my patients is this, that the worst thing that can happen is if you stop your treatment program is you will bald naturally.
I know what he's coming to. I know exactly what he's coming to. And that is basically the problem I have.
The worst thing that can happen is if you stop your treatment program is you will bald naturally.
Yeah, I know what he's coming to. He's basically saying it's going to look like an unnatural balding pattern, which is just wrong on your head. And that's basically what's happened to me.
The medical treatment program. The worst thing that can happen if you have the surgical program and your hair continues to bald away
Like
is
what I
that
had?
you're now bald unnaturally.
Unnaturally.
That's correct. And if we have...
And that is a really bad look, because it looks like someone's fiddled with your head and done a bad job on it. No, don't do that. Get the full scalp done or do nothing at all.
If we don't have donor hair left to actually deal with that progression of the hair loss, then you're going to be permanently left with an unnatural pattern of balding, and that's a trap.
Bingo, that's exactly what I'm left with now. That's exactly what I'm left with now. I didn't even see you I saw you after the surgeries for you to check that they all went well and the donor area was healing and whatnot. But this is something I never came back and basically spoke about, the unnatural balding look, which is just off. It's just, it's basically ruined all my looks.
For the patient. And so that's one of the things that makes us super careful about this.
So we don't want to sound like we're against surgery, because that sort of goes against...
You obviously didn't learn that from me, because I never came back to see you, Dr. Knudsen, but I'm sure that you've had patients like me that have done that, and that's how you learnt it.
What we do on a...
It's part of the armamentarium, but it's not the beginning point.
No, that's right. And so it's something that if you're going to undertake that, you should be counseled appropriately. It should be a well thought out and well planned out, so that you know the lay of the land. What are the pros? What are the cons of going down this pathway? And do I have a plan B and plan C should the worst happen?
Yeah, it's called a hair system. When you got no donor area and you can't fix it, it's hair system territory, or it's hair tattoos. Funnily enough, I think Dr. Knudsen, because he was a lot younger when he did mine in 1993, he was probably still, I know he was one of the top ones here, but he probably didn't even come across this, or really did, and didn't even think about it at the time.
Going forward.
So this is a long-term planning exercise, and the thing about hair transplant surgery is that a lot of people think that it's a simple exercise. You just cut the hair out and turn it around the front.
Not a one and done.
That's in the moment. That's not thinking 10 years down the track. That's not thinking 20 years down the track. The key...
You see, that's where I messed up. I was so panicked in the moment. I was a young man watching all my friends attract women, and I couldn't in my late teens, and yeah, that's where I went wrong, a long term. I don't know where, I don't know what to say. It's just horrid.
Surgical planning is not what it's going to look like in a year's time. The key to surgical planning is what could it look like in 20 years' time, because you have to deal with the consequences of that. So we'll explore that.
Yeah, that ends up being a shaved head and exposed transplant scars 20 years down.
In more detail in future episodes. But we just wanted to give you an overview today that, the starting point for us is if we see a problem, we're prepared to treat it. Now, how we treat it will depend upon what we see and what you've done in the past, if anything. And also the likelihood that you'll stay on the treatment, because there's another question we get all the time is, if I start the treatment, how long do I have to keep doing it for? And the answer is, we aren't curing anything, we're managing it. That means it only works if you take it.
That's it. It's not a cure. Hair transplants are not a cure. They're only a management procedure. A lot of men who get hair transplants stay on these medications, and they might even get off them sometimes. They might be okay. But there's another lot of men who will get hair transplants, get on the medications, and they will continue to lose hair. And it needs to be treated, and it's a continual thing. It doesn't end. So guys, if you've had a successful hair transplant out there, 10, 20 years down the road, you may be looking at more.
Even then, over time, and we'll discuss this again, in a future episode, over time, you could still progress your hair loss, even if you do everything we ask you to do.
Bingo.
So it's slowed the leak down to a trickle.
Bingo. You see, this is so guys are saying, oh, get the hair transplant, get on your finasteride, and you're done for good. No, that's no guarantee. No, you might be going back in 10, 20 years' time, maybe even less, and getting more hair transplants done.
Hasn't stopped it, because people say to me, well, I've heard that after 5 years, your body becomes immune to it and doesn't work anymore.
No.
And that's a misunderstanding of what's
Correct,
going on
Dr.
here.
Knudsen.
Right. So I think that's a great point. And just to sort of summarize it is, when is the right time to start treatment? Well, when you start noticing that your hair is thinning,
Yeah,
that's
in high
be
school.
a good time
Year
to
10, year
take
11.
advice, and then make sure you got the diagnosis correct,
Minoxidil
and then
didn't
have
work.
a look at your treatment options, and if there are certain
Hair
treatment
transplants
options
at
that are
19, which were too late.
appropriate for you, by all means, start that under
An
medical
unnatural
supervision.
balding pattern, which
And
looks
that's
disgusting.
starting from the medical therapies, and we've talked about that before with things like finasteride, with minoxidil, topical or orally, with low-level
now having to
laser,
shave my head
and then
every day.
progressing onto the
Almost
surgical
every
side
day.
of things. We don't like surgery being the number one thing
No, it
on
shouldn't
the list
be.
of,
That's
on your
100%
management
right.
plan. It's got to be, in conjunction with other, with other treatment
Bingo.
modalities. But that should be part of the plan. But
If all
in
else
terms
fails,
of
get a hair
timing in
system.
surgery, we're probably very conservative, and ideally don't want to undertake the really young population. Undertaking a surgery in someone who's really young.
Yeah. Back in my days when there was no, as I know I've repeated this over, back in my days when there was no medical topical treatment apart from minoxidil, if that didn't work, you were getting surgery, or you were going bald, or you were wearing a hairpiece back then that were quite detectable and quite obvious.
Which is ironic because it's the really young patient that really wants to have
demanding. So
surgery.
if I was going to give you an overview of it, I'd say, you've got to be approaching your mid-20s before, we're going to start to be comfortable about it.
Yes, that's it.
Now you've realised that, Dr. Knudsen, you operated on me in 19. But I guess when I was 19, it was more like a mid-20s man who's losing his hair. I was at that stage. So I can't blame you for operating on me and recommending it, because really, the options were to lose it, to wear a hair system, a hairpiece that was detectable in those days. They were not as undetectable as they are now, or get the transplant. I was on a damned if I do, damned if I don't, you can't win scenario. Mid-20s is probably right. I agree with you, Dr. Knudsen.
So I hope that's sort of clarified the issue just a little bit for you today. We again thank you. We're really humbled by the number of subscriptions that are coming in now, and the number of views, and the questions and the comments and the feedback. It really is good for us to understand what you care about and what you need more information about, and we'll endeavour to continue to respond to that as we go forward. So thank you for listening to us again today, and we'll look forward to talking.
Okay, I'm going to pause it there, and I'm going to come back with a second shorter video of these two. I'm just considering I should actually go back and get in touch with Dr. Knudsen. I might actually do. I want to have a chat with him. I want to get his thoughts on what he did with me and what happened and how it's affected me. I'd like to get his thoughts. I don't want to do it through his YouTube channel, The Hair Loss Show. I actually want to go in and meet him again, and I want to speak to him about what's happened. And if he remembers me when I was 19, I came in 1993 with my dad. He might, he may not, but then again he might. But I'd like to have a chat with him. Anyway, I'm going to pause it here, and I'm going to find the second video, and we'll start again. Okay.
Hey everyone, and welcome back to the Hair Loss Show. Russell, good to see you.
Okay, we're going to do part 2 now. This is the hair loss show with Dr. Russell Knudsen, who did my hair transplanting when I was 19, and Dr. Vikram Jayaprakash, who I've never met in my life, but sounds like a decent bloke.
Yeah, good to see you, Vikram. Okay, so I've got to say, this is the heart sink one for me, right? So, for a number of different reasons.
The heart sink one. Oh, yeah, your heart sinks if you're managing hair loss as a young man for young patients. Oh, yeah.
today we're going to talk about how we manage hair loss in a young gentleman, and we've picked 18-year-old. But if I see someone that's losing hair at such a young age, I automatically understand. You feel for that individual, because it must be absolutely devastating. They're going through that adolescent phase and all the social implications of losing hair. And
I guarantee you Dr. Russell Knudsen knows. He saw me at 19 when I was going through that.
How it must feel for that individual. But you also, there is that aspect of things. But you also have to understand, from our perspective, we can also see absolute desperation in some of these, in some of these patients' eyes.
You're not wrong.
Incredibly desperate.
Yes.
They are very, very depressed.
Oh yeah, they're desperate and depressed, and the reason being is all their mates are finding lovely, young, attractive ladies in their late teens, and their genetics are just being weeded out like so directly. At that age, women don't want to know men who are going bald, let's be honest. And I've argued with women about this at the time. They go, no, you can be 17 and going bald and the women will love you. No, they won't. No, they won't. Oh, you just have to be confident. Like some Brazilian girl told me once, it's got nothing to do. I said, yeah, but it's 17. Doesn't matter. You can be 17. The 17-year-old girl will love you because you are confident in what you are and what you do. Rubbish.
Some of them, you'd be worried about, suicidal ideation.
And a lot of them as well will come in with family members that
I
have
did.
also bought into the concept. And rightly so. I mean, I understand. I mean, you and I are both parents, so you want to do everything to protect or help your child. And if this is you want to come and see someone who does hair transplant, that may be the option to.
So the irony is when
you almost feel like you're ganged upon. So there becomes a pressure from that.
When mum comes in or dad comes in and he's wearing a baseball cap, which you won't take off unless you ask.
Yeah, I remember when my dad came in with me. He didn't have a baseball cap on. He was having his bald head. And Dr. Knudsen told me, he said, you see that, your father's head? He says, the chances are, with your genetics, it's going to head there. My dad is a full bald, a little bit past the crown, the full spectrum. He's not wrong. It happened to me as well.
My heart sinks. And the parents inevitably think the solution is a hair transplant.
Yes.
They don't come in to talk about medication. They come in to talk about a hair transplant.
So...
Yeah, luckily, as I've mentioned throughout this video, luckily there's medication available now, which I would have got on way before if I had the chance, if there were medication back in my day, but there wasn't. I would, if it was today and I was 19 and going through this, yes, I wouldn't do the hair transplant. I'd do the medication route.
Again, this, automatically we know, I can say this, that when we're dealing with that patient, we know that it's going to take a lot. This conversation is going to go on for quite a while. It is not a quick consultation.
No, it's not.
It's not here. This is the plan, and this is what we're going to do. Boom, boom, boom. It takes a lot to unpack what the issues are, and almost try and reprogram what the individual patient is feeling, what their thought process. Because generally speaking, they've come in with a set of ideals of what they want the outcome to be, and generally speaking, they want to have surgery because they feel they've seen pictures that this is going to be the panacea.
And their parents want a happy child,
of course.
Oh yeah, that was my case. I was very unhappy. My parents weren't happy. As he says, you see the pictures of all these successful hair transplants. I've seen a few videos ago. I think I put up the one with the Elon Musk pictures. But not everybody is Elon Musk, and not everybody can have a successful hair transplant. In fact, a lot of people I know that get them are not satisfied with the overall because there's a lack of density or thickness or coverage, and they have to go in and get things redone or get rid of the hair.
This is the issue that the consultation is just as much about educating the parents as it is about educating the child, the young man. So, I mean, clearly, the way I started is a discussion of the biology of baldness and the genetics of baldness. If the father's there and he's got quite a bit of baldness, that certainly helps in a visual way to.
Oh, he must be channeling the time he saw me with my father's full bald head when I came in and saw him at 19 and 18. He must be channeling those memories, because that's exactly what he did. He went through the genetic discussion, me and my father. Spot on, Dr. Knudsen. You got a good memory, mate.
Find what the future looks like.
Yes.
You don't always see that. I like to then talk about the medical options and how that we're better at preventing hair loss than we are at regrowing it. In most
We
of our
didn't do that with
patients,
me
and
because it
how
wasn't available.
This is a genetic issue. This is not something that you're going to take a 2-week course of antibiotics to deal with. This is something you're going to have to deal with for the rest of your life.
Yep.
And then the discussion around medication comes to people saying, yeah, okay, but do I have to take medication for the rest of my life?
You probably
and
will
the
have
answer
to.
I give them is no, you have to take medication until you stop caring.
That's
and
it.
We'll come back to that point.
Which means you'll probably take it for life because you have to care for
You
life.
only have to take medication as long as you care.
Which is pretty
But
much
if you stop the
all of life.
medication, then, and you go bald as nature intended and you're okay about it, then we haven't done
Peter
any harm.
Stevens, stop that.
But once we operate, the potential for harm is in these people is very great, because once we operate, further hair loss, whether they don't take the meds for the rest of their life or whether they do take them and they're not 100% effective, which we have nothing that we can guarantee is 100% effective.
No,
we're
nothing
making
is.
it bald unnaturally. And that's going to lead.
Yes, the balding unnaturally. I think I spoke about this earlier in this video on the other clip. That's what's happened to me, because you get the hair transplant, those gaps, those horns, as he says, start to appear in the side. There's gaps to fill. The rest of whatever you had behind it goes further down the sides, and it's an unnatural look because you've got a 1/3 patchwork on the front of your hair and your hairline, and when people see you at the front, they see that patchwork. They look down on you, it thins, and it's just a horseshoe shape beyond that, and it looks terrible. It's unnatural. And let me tell you, it's not a good look. It is not a good look.
There are consequences.
Consequences.
So this
Oh,
is a
yeah.
very, very big issue, and I'll tell that quick story now.
That's a big issue. You have to live with that for life, like I've had to. And those are bad consequences.
About what I just said to you. Patient came to you this week. I'd seen him at the age of 18, begging me for hair
Oh, here we go. This is what I should do with him.
transplant. I put him on medication, said no. Came back to me at 19, begging me for hair transplant. I said no. I warned him about the consequences of this. Came back at 20, begging me for a transplant, still on medication. And he seemed to be, under control at that stage. So I reluctantly agreed to do it.
Yeah, I mean, that's pretty much what he says is correct. I mean, looking back on it, he did mine at 19.
So I reluctantly agreed to do it.
Yeah.
Then I don't see him for 8 years, and he comes back in a couple of weeks ago with isolated grafts out here and balding in behind as he's receded back.
Yeah, that's what's happened. Yes, that is basically what's happened to me. They're not isolated. They're still in fairly patchwork rows, but the balding is right behind, and those gaps, that the horns down up the side have split the non-transplanted hair down the side with the transplanted hair up the front.
Behind the grafts. And I said to him, I said, do you want to top up? He said, well, not really. I don't think I do. He said, I just don't care anymore. I don't realise,
Well, if he was lucky enough to find a woman he's attracted to and looking like that, which I would highly doubt, if he's lucky enough, then he wouldn't care anymore if she didn't care. But chances are he probably hasn't. And the chances are he probably thinks I'll just shave it now and forget about it because shaving is socially acceptable.
Know why I went through with this, because I don't care anymore. And now it's just like, well, this looks wrong.
It does look wrong.
Did I not warn you?
It does look wrong. It looks horridly wrong. And that's exactly what my scalp looks like now.
Numerous times 10 years ago that this would happen. And he said, you did. You said it to me. I don't blame you. He said, I don't know. I must have been having crazy thoughts, at the time, because back then...
Yeah, I don't blame you either, Dr. Knudsen. I was panicked, as you say. I was a young man. I didn't know. I was living in the short term, not thinking long term. Well, I mean, what can you do? What can you really do? You just let it go and you're damned anyway.
I really cared about it, and I was devastated, and I twisted your arm.
Yep.
Now I don't. So I don't blame you, because you really did warn me this would happen.
Yep.
So I said, well, what do you want to do? He said, well, I don't know what I want to do, but I really just don't care anymore. I said, well, you either can cut them out, you can laser them out, or we have to graft it.
Okay, cut them out or laser them out. Get him laser surgery. That might be an option, I'll just get rid of... The problem is there's still a few dents where the hairs went in, where Dr. Knudsen grafted my hairs, and there's still a few dents. But I guess the hairs can be lasered out. Getting them cut out, that might be a bit vicious. But lasering them out might be an option for me.
Behind and reconnected, you go back on meds, because obviously he'd stopped his meds as well, because he doesn't care anymore. So I had this real sinking feeling in my chest that because I thought I was trying to help this young man, I ended up harming him. And the first rule.
Yeah, don't have that sinking feeling, Dr. Knudsen. There's nothing you could have done. Like in my case, mate, you didn't really. I don't know if you warned me as much, but you gave me the option to wear the hairpiece behind it. Yeah, but I wouldn't blame yourself, Dr. Knudsen. Men are like that. You probably know. I know you'd probably feel bad about ruining the man's life and whatnot, like you've done with me. But don't feel bad about it. It's not really your fault.
Doesn't do no harm. And so I felt really, really devastated about it as well. I went home and told my wife that I was feeling really low about it, because this is something that an experienced person like me, shouldn't have to have happen in their practice. I mean, I can understand why new surgeons in the field, might have a problem, but I'm an experienced practitioner, and this shouldn't have happened to me. But my willingness to help him and think that he was going to be a lifelong patient because he was so committed to the idea of taking his meds and he was so desperate.
And I think that speaks to the immense pressure that sometimes, when we're sitting in the chair, when we're faced with someone who's, emotional, and you can see their pain, and they've come in with support that.
My dad.
What they want.
I wasn't emotionally well.
There's a lot of pressure to try and help them or do what do your best for them.
And you're treating mum sometimes as well.
I agreed. It's interesting. I mean, we're going off topic here.
Mum was
but
too scared to come in.
Recently, Jeff Bezos was interviewed
the
by
bald man
Lex
himself,
Friedman.
Bezos.
Lex Friedman is I think MIT, but he made a very interesting point. He said one of the things as a CEO you've got to be able to do is to really think through these one-way door decisions. So most decisions are two-way doors. So if you go down that road, you can always sort of go, oh, you know what, it didn't work out. I'll come back out. But if you go through these, if you're faced with a one-way door decision, you've really got to think it through, because once.
Yes, as I've been saying previously, once you start a project and you go through that door and you leave it mid project, or you want to walk back the other way, that's not going to work for you. You may as well not start that project to begin with, or you better go the full way.
Gone through that. I mean, it can be immensely. There's no going back, or it's immensely difficult, immensely expensive to do that. So they got to really make sure. And I think, and I heard that, and I was like, this is one of those. This is a one-way door decision. You've really got to. If you're suffering, 100%. If you're suffering from hair loss at a young age, hair transplant is probably firmly at the bottom of the list. You've got to try not.
I wouldn't put it at the bottom, but it would be near the bottom. I'd say with the medications available now, it's very near the bottom. When I had to do it without these medications and with minoxidil that wasn't really good, it was kind of towards the top because there weren't that many options. But nowadays, with these wonderful wonder drugs that stop or halt or regrow your hair, halt baldness or regrow your hair, I would definitely put it towards the bottom.
As everything else, try and push that decision out as much as possible. You're not closing the door to that decision in the future, but if you do walk through that, then you're committing yourself.
And we need to also understand that
that's right.
Teenage men, or even to their early 20s, can be very emotional, very impulsive.
Oh yeah. Oh, he's smart. He's probably seen a few of them, not just me, over the years. Now I've realised I'm probably not the only one. Skip this.
Into their early 20s can be very emotional, very impulsive. They do risk-taking behaviours, and they don't think through the consequences of their actions. And so, we've got to protect them against themselves.
Well, I wasn't really a big risk taker back then, but when you're going through hair loss in your late teens and mid-teens, it's another story altogether.
As much as protect ourselves. And so I think that it's a difficult conversation to say no to someone who's desperate. That requires a certain strength to it. Yes. But I think it's the education of the patient that's critical here. If If you just say to someone who comes in that situation, no, he'll go somewhere else.
And
that may still happen anyway.
That's the challenge, because you know what? For every one of you that will say no, there'll be 50 other people that will say yes.
Well, I had another one that I said no to at 18. I said no to at 19, and he came back to me sheepishly at 21 with transplants in the front that didn't look good, and he'd been to St Elsewhere's.
Transplants in the front that didn't look good. Yeah, because they don't. They need to, like what happened with me. It needs to be covered up with a hair system at the back, or it needs to be a thick, full density where you cannot see scalp at the front for you to do that. Otherwise, it still looks like a poor comb over. It doesn't look good. He's 100% right, but unfortunately, Dr. Knudsen, that's what you gave me too.
Because, I wouldn't operate on him, and now my hand is forced. He's through that one-way door. What am I doing? So I've got to fix it now at 21, whereas I was hoping not to have to touch him for a long while.
Yeah.
And it's not, you've got to understand our perspective here. We're not scared from personally about us saying no to someone and them going to a competitor. That's not what we're talking about here. What we're talking about is there are plenty of people out there who would take him on.
Yes, because it's a quick
quick fix, and that's what he wants,
Yeah, because a lot of these doctors, they're not ethical. I know Dr. Knudsen. I know him personally. I've been through 3 hair transplants with him. He's a pretty ethical man. Yeah, but a lot of these other cowboy doctors in the industry wouldn't be ethical. They'll take him on, give him a quick fix, and then down the road he'll need more, or he'll look like crap.
If you think of this as he's a customer and this is what he wants, and I'll give him this product, then that's what happens, and then you get to deal with the consequences of that somewhere down the track. So we have great empathy, we have great sympathy, but it's about educating these young men. And if you're a parent listening to this who has children with hair loss, please be aware that this is a very complex situation in a young person.
Absolutely.
And even though it's devastating psychologically,
Oh, absolutely.
the fact is, if we can start a treatment process for them that's not going to harm them, right, with low-dose medications, and this is usually what the situation is.
Yeah, I'd do that
and they
first,
can
that's
see
right.
stabilisation, or after 6 or 12 months, a bit of improvement. That has a dramatic effect upon their psyche.
Yeah, they're lucky if they see stabilisation. If they do, it'll be the best thing for them. If they don't, well, then they're up, what creek. I don't know why is someone from Louisiana calling me?
We just can't fix it overnight. Nothing happens overnight. You've got to be with us on the journey.
Do you remember, again,
okay, you've got to be with us on the journey. In other words, what he's saying is once you start that project, once you go through that door, there's no get off. You can't get off mid-ride, you can't reverse the ride. You're on it to the end. And that was something that I made a big mistake with. I took 3 and got off the ride, and dating and relationships has just been in the gutter since, absolutely. And what I've had has just been, dates, blind dates. Everyone seems to have a boyfriend when they don't. Everyone seems to not want you to approach them. Everyone walks to the other blokes. You can talk to them and make them laugh, and they choose the better looking man at the end of the day. It's a one-way ride, and you better not get off.
Months ago, I put up a poll and I think you sort of entered that as well, about this topic on who would operate. And so this is a WhatsApp group that we're part of, and it's full of doctors from all over the world asking a similar sort of question. The results were not clear-cut. No. There is a variety of responses and opinions. And so I think majority of people feel that, okay, look, operating in a younger individual, I think the example I put on was a 21-year-old. But even still, I think the viewpoint, it's varied, and people will try and make a justification, and I understand the arguments across the board. So we are quite conservative, but we're conservative for a reason. And you've seen, and I've also seen patients that have come back, and it's the heart sink one when they go, I've done this in the past, and I wish I hadn't done it. And you go,
I'll see if it's a good result.
I tell you what, Joe Rogan said it was the dumbest thing he ever did in his life. I don't disagree. I think it was mine too. But yeah, that's just life. That's just what you eat when you make a bad decision. The dumbest thing, yes.
So
Yes.
you've got a technical and a cosmetic result from the operation that was quite good at the time, but it just hasn't aged well because of the.
Yeah, as I said, it wasn't an unsuccessful. What I had done myself was not unsuccessful. It worked. It's just that the result happened. It worked. It worked. But as it aged, but also the actual end result, like what was promised, like what you said, Dr. Knudsen, people will see. You told me this. I remember you telling me this. People will see you from the front. They'll see you with a full head of hair from the hairline, and then they'll think you've got a full head of hair. If you feel bad about that, get the hair piece behind it. That's what you told me, okay? People don't see full head of hair, especially when you're shorter than average for the population. Like I'm 5'6". So a lot of people can look over you and look down on your scalp and see what's going on. Yeah, it doesn't age well, and even if it's successful, a lot of times it won't age well.
The expansion of the baldness. So I think the take-home message is that we have better options now in our younger men to manage them than used to be the case.
Yes,
when I started
correct.
in the field, there were no medications, so a transplant was the only option.
Yes, you're going back to probably even before my days, or around my days, maybe even before that when you started in the field. I know you were younger when you did mine. There was no medications. There was minoxidil or good luck. Transplant was probably your only option.
And so maybe you were a bit more tempted because there was no alternative.
No,
now we have good alternatives to offer these young men and their families, and that's what we need to explore first. And I try not to talk about the transplant at the first consult much at all.
Don't blame me.
Say this could be a bad idea. I want you to focus on what I'm telling you now. There's only so much information they're going to take in on a first consultation.
Yes, because usually saying no is throwing them off their perch, so to speak, in the sense that they weren't expecting someone to say no. So it's having to walk them through what the options are. So I think we've gone down a little bit of a rabbit hole, because I think the fundamental thing, probably the take-home message that we want to give you, is that if you are in the sort of category where you're a young adult losing hair, you've got to think through your options. Make sure you get assessed properly, that you've got a long-term view of what potentially could happen.
I can't
what
emphasize
the
that
options
point
are,
more than enough. That I cannot emphasize that point more strongly. A long-term view, because one transplant is not going to fix it, nor is two. It's not a one-shot cure-all. Let me tell you.
Try and delay surgery as much as possible.
If you're a parent of one of these people who are watching this, because a lot of parents do their research like this, then understand why it's not as simple as we'll go in there or talk to a hair transplant doctor and get a hair transplant.
Yes.
Yep.
It's not
Bingo.
that simple an equation. This is
Absolutely
going to be a
not.
complicated management that has to be done over.
Looks like Dr. Knudsen has learnt a lot over the years, and I'm pretty impressed. He's a smart man. Maybe when he was younger he did mine, I wasn't so impressed, but I'm impressed with what he thinks now. He's definitely changed. I might even, as I said, I might go back and try to catch up with him and see what he thinks, and just tell him about my life experience since.
Period of time, it requires very careful thought, and you have to be an advocate for your child as well as us being an advocate for that person, to make sure that we're doing the right thing in the long term rather than the instant fix that everybody wants. We want the problem solved yesterday.
We obviously feel very strongly about this.
Indeed.
On that note, thank you again for watching. I hope you have enjoyed that. And
okay, that's it. Now, two things. Move away from that. Joe Rogan's not wrong when he says it was the dumbest thing he ever did in his life, especially FUT like I did. It was dumb. Didn't leave enough donor area for enough full coverage for a future transplant. Especially at my age, it was probably dumb, but there was no real other alternative apart from a very detectable hairpiece back in the early 90s. Or just going bald and just kept getting rejected, and kept, 17-year-old women don't want bald men. 27-year-old women maybe attract some, maybe very few, but there were none when you're 17 or 18. the other thing I wanted to mention is, I do want to go back and see him. The laser removal for the hair from the graft side, I want to ask him about that actually. I want to ask his opinion. I actually do want to go in and I want to ask him. I might leave him a comment on one of their new YouTube videos and ask his opinion. I'd like to go in and speak to him in person again. Man who did my hair transplants. He seemed like a pretty knowledgeable man, a good man. He was one of the top men in Sydney doing it back in the time, and I was absolutely under no hesitation to do it with him. He did a good job, but unfortunately the results didn't really work out the way they should. Yes, the laser removal of those hairs. Oh yeah, that's the other thing. When I went in for the consultation earlier this week, there was a bloke there was patient room 1 and patient room 2. So he took me into his office, and behind his office there was a patient room 1. As you walked to his office, there was patient room 2. Some guy came out. They were probably looking at, I think he was looking at the, doing an examine of the results of the transplants that were done. He came out, he looked down, he was like, he had glasses, he was probably about my height, maybe slightly taller. He looked young, he would have looked in his mid-20s, maybe late 20s. He came out and I just saw like good hair, like good coverage, just a little bit of white at the front, in the front half of the scalp. So he probably needs another 1 or 2. But it looks like that particular transplant that bloke got went okay, and he was pretty happy by the looks of his face. So, yeah, that's it. I won't be discussing this anymore. I think I've said enough and reviewed enough and watched enough. Stay tuned for the next one. It'll be how I get overlooked by a girl who I was set up with on a blind date, who suffers with eyebrow alopecia in the eyebrows and gets eyebrow tattoos. Overlooked me and probably overlooked other blokes she would have dated during her time as well. And she went for IVF single motherhood over most any man she would have ever dated, including me, because obviously we're not good enough for them. They're expecting something a lot better. Women expect a lot from men these days. It's not even just looks. Looks is just part of the package. That's all I'll say. Have a good day.